Resources management is more than hiring, paying, and training people. It's an integrated set of systems, practices, and policies in an organization that focuses on effective deployment and development of its employees. In other words, HRM ensures that an organization will be successful by having the right people in the right places, doing the right things at the right time. So, what is HR doing? Where is all that time going? And can it be fixed?
Hello, judges. Meet Paul. He's one of our new talents at Markham Stouffville Hospital. He's planning a trip to Vegas and wants to know about his employment entitlement benefits. He goes to hospital's HR portal to find this information. On clicking, Paul has to read a 60-page long PDF, which he was not looking forward to and was left confused as he could not understand the technicalities. Paul then decides to follow up with HR department as his issue wasn't resolved. Christy, who works in the HR department, received Paul's request. Unfortunately, she was busy scheduling interviews and orientation for the new hires. She could only get back to Paul the next day. The most important issue in this scenario could be summed up in one word, and that is conversation. As these documents are drafted by attorneys, they are full of technicalities and jargons and often fail to communicate to normal people. At Superscript HR, we have designed a solution which we believe has the potential to address this problem. We address to implement a language compliance software which will analyze different elements of writing such as length and structure of sentences as well as number of words and will restructure and rephrase the entire document into simpler, plainer and more approachable sentences. We also plan to develop an inbuilt calculator which will calculate the exact amount of money employees contribute to their pension or in Paul's case, know the exact money which he will need to spend from his pocket. We also plan on integrating AI-based bot to address the direct queries. We plan on developing a mobile application called B, which is not a great word for Scrabble, but it stands for Benefits of Employment Entitlements. So join hands with Superscript HR to fulfill this gap of communication and make the process seamless.
Our second challenge was to create a business case for Octochain. When a healthcare worker applies for a job, they are expected to provide many certifications. But how does the hospital know the applicant's documents are legitimate? How does the applicant know their personal info is safe and cannot be compromised? And lastly, how can the certification institution ensure nobody can forge their documents? This is where Octochain offers the ideal solution. The permissioned distributed ledger can manage all documents in a decentralized ledger, ensuring safety and trust. Octochain's ledger can store all certificates authenticated by the institution and distribute it as needed. This reduces the resources hospitals and institutions have to invest in managing their internal database servers. Furthermore, a key benefit of decentralized ledgers is cybersecurity, since there is no single point of failure, which further reduces the IT budget. Records in the Octochain's ledger cannot be altered or forged, which guarantees authenticity of the certificates. This protects the institution's reputation while also giving hospitals the peace of mind as they can quickly and accurately validate the certification and choose the best candidates for the job. So, why should certification institutions and hospitals choose Octochain? Because they are a startup focused on developing strong business relations with their customers, their distributed ledger, along with blockchain wallet technology, makes storing and distribution of certification records simple, and the solution is applicable to a variety of business sectors.
In terms of next steps for Octochain, we'd like to conduct market research via focus groups and surveys with HR professionals working in hospitals to understand what the key problems are with the hiring process, specifically as it pertains to validating certificates to further develop our business case. These first-hand accounts will help us narrow down on exactly how to position the product in the market to maximize the chances of its success. We're also interested in conducting a pilot program with a hospital or clinic to test the solution.